Hi everyone, today I'm here with George the dentist. Hi George, thank you so much for letting us interview you.
My absolute pleasure, thank you for coming.
Thank you. I know you had a long day today.
Yeah.
So we're going to jump right in. Tell us, what is a typical day for George the dentist like?
Okay, it is quite varied, right? But my general day-to-day is that I work pretty much 5 days in my own private practice in, well, here, Wimbledon, southwest London.
The brick wall.
The brick wall. And I tend to focus more on like aesthetic restorative treatments, right? But then saying that, I think it's easy for some people, like especially when you see all this stuff on like social media, it's easier for maybe a young dentist to see the work that we're putting up and think, wow, that guy or that girl is only doing like beautiful cosmetic rehabs all day long, every day, Invisalign, bleaching, bonding, etc. Look, there is, as your career progresses, you do start to do more of that. However, we all do our bread and butter stuff. You know, you're doing your general dentistry, you're doing your just composite fillings, whatever like that. But it's mine's private dentistry all day, basically. I'm about a day every other week. I do a teaching day, so I might teach like the FDs, or I'm in some university somewhere. Started doing some teaching with Invisalign as well. So yeah, that's the general stuff basically.
So let's hear your story. Why dentistry? Have you always wanted to be a dentist?
What, it's luck rather than judgment, right? Because I think, who really knows what they want to do when they're, 15, 16? You knew.
I always felt a bit sad.
Not ingrained in you from your parents or whatever?
My dad's an engineer.
No? Fair enough. A lucky one.
Sad,
right?
yeah.
And I thought that, to be honest, like my parents were kind of pushing me towards to doing like a profession. So thinking like veterinary science, medicine, dentistry. So I did quite a lot of work experience in that field, and then started to kind of feel towards the dentistry. Look, I'm not gonna lie, a lot of it was because I heard it was a good career, right? So then kind of went into it. You know, definitely throughout university I was thinking, is this right for me? I'm not sure. You know, you have those bad days, you're just doing things for the first time, treating patients. I found it like really tough. Yeah. But as time went on, I kind of got to grips with it, started to enjoy it a lot more. Yeah. And I think, to be honest, that is continuing for me. Like every single year I get further into the career, I enjoy things a lot more. Like I've done a lot more, because you get a lot more confidence with the treatment that you're doing. You become, you know, you're like, actually, I think that I can do this pretty well now. Whereas before, when you're doubting yourself quite a lot, it's really tough.
So what do you enjoy the most then?
I like making things look a bit prettier, but done well, you know? So if it's something simple from like a DO on a 6 or something, I want to do things systematically to the best of my abilities. You know, everything's isolated well, everything is done to hopefully the step-by-step the way that it should be done. I like placing an onlay well, I like doing some nice ceramic works. I found that also, as my pathways continued, I'm starting to do a lot more of the bigger cases now. So I'm doing a lot more restorative work, you know, your full mouth rehabs, your pretty stuff at the front of the mouth. But it's so important to remember that it's the whole mouth you're treating. There's no point slapping on a load of nice veneers and finding that you've got some wear that you haven't treated, or it's done in the wrong bite or something like that, basically. Started doing a lot more of Invisalign, bleaching, bonding,
So what would you say you'd find most stressful about dentistry? Because I find sometimes these full mouth rehab cases quite stressful.
Look, the thing is, of course that is, right? And again, it's all about the planning with that. And sometimes a patient will come in, they've got a mouthful of whatever, and you're like, where do I even start with this? But then once you get a decent set of photos, you've got your articulated models, you can take time to plan that. That patient isn't expecting that reply straight away, or that letter saying this is what we need to do. And it's important to stage it and plan it well, but obviously that's going to be stressful. Yeah. The biggest stress that I found in dentistry is time constraints of patients. So, for example, I've had this case recently where it is a full mouth, and this guy, because he flies in and out the whole world, he's a banker, he's flying here and there, he wants it done in very specific time schedules. Yeah. So suddenly you start to, every single thing has to go on point. The lab work that comes back, it has to fit well, it has to look good, and this is where all the planning comes in. And then so suddenly if that doesn't work and the patient's flying off somewhere, it's that time constraint that is stressful. But I think the most stressful thing in dentistry is managing patient expectations. And say, for instance, if you're busy, you're going to have a patient that comes to the door that wants to see you yesterday, and you're like, well, look, I'm fully booked, I can't, and they're demanding, they're getting a bit aggro at reception. And that's the most stressful thing, because unfortunately in dentistry you're always on a back foot, and you have to really try to provide the best service that you can to that patient, but it's keeping them happy.
I had one actually call the other day who shouted at reception. I've only seen him once, and said, oh, my tooth's hurting, and if you don't fit me in on Monday, I'm going to hold you responsible. Literally, I'm going to hold you responsible for my tooth.
I know.
He hasn't been to the dentist for 20 years, but it's my fault.
And what a joke that is, right? And I think that is just so incredibly stressful. And it's because you just, suddenly someone, even if it's a complete unjustified complaint to you, right, about that, you have to go through a lot of stresses then, speaking to your indemnity, worrying that this guy's done this, worried about your notes. Suddenly you're like, oh my God, I didn't take whatever, like a ridiculous, and that's ridiculous.
So how do you cope? Because I had a few people when I asked on Instagram, what would you like to hear from these Denfluencers? They wanted to know, how do you cope with stress? Your coping mechanisms? Do you have like a mindful routine?
No.
You don't?
No. I don't have that app. What's that called? Headspace or something? Maybe I should think about it. Everyone's nodding here. Maybe I should think about getting that right. It is important to switch off when you leave the surgery, right? And I know, again, how hard it is. And again, you'll worry about that contact point that isn't maybe perfect, and you'll think about it before you go to bed. But again, throughout time, I've learnt to try to switch off from that a little bit, Socialising is really important, Speak to like-minded individuals like yourself, realise that everyone's going through exactly the same thing. I try to go to the gym, work off some steam sometimes. And the other thing that I think that helps you quite a lot is when you are doing kind of a lot of courses and post-grad education outside, gives you a little bit more confidence to kind of know that you do kind of know what you're talking about, right? That helps a lot. What's actually helped me a hell of a lot with my confidence is the whole social media thing. So, starting Instagram or whatever, it's everywhere now, isn't it? Like a couple of years ago, it's very hard to gauge the quality of your own work because no one sees it, right? And you can try to go to every single degree to make something perfect, but again, the patient doesn't care. The patient only cares if it's like smooth and
shiny.
Yeah, exactly right, not painful. That's helped quite a lot. And the other thing that's helped as well is that when you start to put a lot of your work out there, you start to photograph it a lot more. So you start to really critically appraise it, because suddenly you look at it and this big SLR shot on the screen and you're like, that's not as good as I thought it was. So then the next time you do it, you'll fix that point, and the next time you'll fix that point. And that critical appraisal, it gives you, I found myself, it's given me a lot more confidence with stuff over time.
So that's why you sound like you're quite pro social media then.
I don't know, it's a bit, I find it all a little bit cringe, to be honest.
I thought you did, especially that post you had of yourself posing in front of the wall. So I thought you found it cringe, and then I saw your witty captions, and your stuff is amazing. So just borrowing him up there. But so I'm just wondering.
I find it, the thing is, when you look at social media, it depends the route that you want to take, right? But you see some people on social media that are more, maybe not about the dentistry so much, but about the lifestyle, But there's no problem with that, right? But then you've got the people that are posting a bit more of the dentistry side of things. I think it's, which is probably like 90% of the work that I stuff. Yeah. I think you have to chuck in a little bit of personality in there. It's good for your patients. It's kind of good for your marketing, so patients see that. Because that's the thing, if I'm just putting dentistry in there that sometimes is a little bit gory, patients are going to see that and not really want to see it. So you're going to lose. The whole reason I started it is for marketing, basically.
So that was your main goal?
That was the main goal, yeah. And it's just turned into a fact. It's gone a lot, kind of less from the patients, but more towards the dental following, really. But then I quite like that, I like being almost respected in the field for doing that stuff. And patients actually do still see it, and they're like, wow, if these dentists are commenting, maybe he's all right. So it's, the talking on camera, all that, like,
hi guys.
Yeah.
That's what I do.
But look, you stick to that, right? Yeah. And I'm sure the dentistry is fantastic as well, by the way, of course.
He's been watching my dentistry. I don't place liners, by the way, guys.
Yeah. Okay, pulled her up on that. So yeah, that's that basically.
Okay. So do you think with social media that there's also some negativity in it? Because massive amount, and it's again it's growing the whole thick skin thing. One of the reasons that I didn't start doing much social media at the beginning is because I was really worried about the critique that I was going to get. So you put out work, and it's not. I think that we really need to be a bit more of a positive profession, and I think that we are getting there, right? And I think there are some people out there like Dr. Afan, etc., that are just so lovely. He's just so nice if you're watching this.
They're so positive, and that is a really good thing, right? But you do get the odd people that aren't, and I do think, especially, I don't do much Facebook stuff, right? I think there are some trolls out there, and I actually tend to think it tends to be, I think, a dentist from the older generation, right? And I think they're almost, I don't want to judge anyone, right? But it's too critical. I think that some people who are putting this work out there on like Instagram or Facebook, they're really trying. And they're trying, and they're going to be putting more of an effort in for this stuff. So I only think it's a good thing for that. So for someone, for like maybe an older chap to come back and be like, look, that's whack, whatever, that guy or the girl who's put that work out there is going to take that to heart. They're going to be knocked. And, it's very easy to hide behind Facebook. And it's like, well, if you're criticising that, let's see some of yours then. Get it on the plate and let's compare it. And also the other thing that I find really terrible is that some people specifically are being very targeted, and then maybe like a lot of people will like comment on it, and they won't specifically mention that name, but they will mention factors that are definitely pointing to one person, and it's bullying, and it's not nice.
Why do you think they have such a bullying culture? Is it jealousy? Or?
I think, to be honest, a little bit is jealousy. And I don't want to, because they'll be like, no, it's not. But I think that, especially some of these like younger chaps who are very enthusiastic and making a really good brand for themselves, I think some people of the older generation might be thinking, well, how comes he gets to do that? How comes everyone knows who he is? They're going to him, but they're judging that lifestyle without actually judging the dentistry that's being provided, that a lot of the time is really nice. Really nice.
Yeah, some fantastic dentists, aren't there? So let's talk a bit about your practice. So you're a partner here at Ridgway Dental, yes?
So basically, I have worked here for about, saying my age now, like 9 years. I started here a day a week straight out of my vocational training. It was called VT then.
I was VT too.
Okay, fine. So after that, I started a day a week, and I started in general NHS practice as well, with working for a guy called Aaron in the NHS practice. And then I worked here for about 4 years. It was nothing like this. It was quite old, no equipment, there was no specialist services. But I stayed here because I thought it's such a nice area
it's a really nice
that I thought the opportunity might become apparent to take it over. And then about 5 years ago now, they offered the practice to me. So I took it over with Aaron, who was my boss from the other place. Like you say, Aaron. Hi, Aaron. So since then it was again, we didn't have any equipment, we didn't have specialists that worked here.
Yeah.
And then we introduced orthodontics, specialist perio, we got our microscope for our endo, invested a hell of a lot of cash into it to provide the services that we wanted to do. And then we got so busy that last year we had to extend the place. So this was actually here, this was all a wall up here, and there was a flat upstairs. So we took the flat over, knocked the wall down, and then added the 2 more surgeries up there. So it was just the two down there basically. So now we're 4 from 2, and we've got it's I feel super lucky.
Yeah.
It's I've got a really great team, and if a patient comes here with quite complex problems, like full mouth stuff, I'm like, look, have your perio, have your ortho, have your implant. I'll make you look pretty. Exactly, right?
That's good, that's what you want.
Yeah.
So if you were giving advice to anyone looking to buy a practice, in your opinion, should they be going for is it better to get a private practice or an NHS mixed practice?
I wanted to, look, in my opinion, I've gone the private route, right? Because I really struggled in NHS practice to justify certain things, right? Because I would always want to try my best. So say if I'm going to do a endo on a upper 6, I want to find my MB2, I want to spend 2 to 3 hours on the endo. The crown that I put on it after, I want it to be perfect fitting. And unfortunately in the NHS, as we all know, you'll end up living in a shed if you do that, right? And my crown, I want to be fitting, I want a nice crown from a lovely lab, a couple of £100 lab fee. You just can't justify that.
No.
And I just got bored of the discussions with patients. So I'm like, look, you need this crown on the premolar. Do you want it really nice? They're like, well, it's white. Let's just do that. And then, and then it comes back. It's a bit opaque. They're like, well, yeah. So I just got bored of those decisions. And then I've done quite a lot of post-grad study. So if I want to put that into practice, NHS didn't really make too much sense for me. So I was quite lucky that I was working in a practice that wasn't doing that well, so I could buy it for a price that was actually pretty good. And then by introducing all these factors, these specialisms, you start to get a lot more high value treatment that comes in, and then you can start to expand the practice and then hopefully work in a lovely place.
So what do you think the future is of dentistry, NHS dentistry, private dentistry, just dentistry in general?
The NHS system is an incredibly hard one to cater for. I do think that some people are designed to work in the NHS system like we have kind of now, that are just happy, just patch up, blah, blah, blah. Not that NHS isn't patch up, I'm not saying that, but it is really hard to do top quality work for a whole mouth, right? I can't see that the way the system... I don't really know the system that well now because I've been out of it for a while, but I don't... Something has to change in order to get quality treatment for everyone. I don't know, basically.
And does your charm work on all of your patients?
Of course it does. Of course it does. It's just back there, bubbling away. And sometimes on there, something could come to me and I'm like, bang, there it goes.
So you're just naturally funny?
I don't think so. I don't think so at all. I think it just, it comes out when it's needed at the right time. Maybe not in general, though.
So not while you're treating?
Not while I'm treating. Yeah, when I'm at work, I find that I'm really professional. You can have a laugh with your patients, obviously, and it might make them a little bit at ease, but sometimes it's easy to take that too far. And I think that maybe a patient will be looking at you and thinking this guy is just a joker rather than me coming here for a nice crown. So you've got to gauge that a little bit carefully, because it's easy to offend. Yeah,
that's very true. And any advice that you have for up-and-coming, newly qualified dentists? Pearls of wisdom.
All right, so first thing, get some loops. Right, loops are just so important because you can't... I got my first set of loops pretty much just out of VT, actually. And when you start using them, it makes you realise what you weren't seeing before. And just without loops, I'd say if I have worn loops every day since I got them, right? If I didn't have my loops, I'd have to call in sick that day. I honestly don't think I would put my patient through that because it just helped see so much stuff. So that's first thing, right?
Okay. Loops. Check.
Second of all, try and get a half decent camera set up. So get your SLR camera, nice set of flashes with it. Go on maybe, and then in fact, what helped Minesh Patel's course, Focus, good. You learn some stuff. Yeah. Because if you get your camera and then you start photographing your work, you will critically appraise it. Yeah. I think my dentistry in the last year and a half to 2 years since I started posting a lot of stuff on Instagram has got 10 times better than the 8 years before that. So appraising it and trying to just get that little bit better every single time makes a massive difference. And third of all, do some courses, basically. Look, I don't think it's necessary automatically to jump into some like master's degree like I did. But I think some private courses, they work so well towards everything. Start using rubber dam and use a sectional matrix for your composites. Yes. I think as an associate, if I were to hire one, if one comes in with a good portfolio of photos, using rubber dam, sectional matrix, that is, to be honest, is half of it, isolating things well.
Yeah, that's good advice.
Yeah.
Okay, future goals in terms of your work, personal life, business?
It's a hard one, you know, because I am a person that doesn't tend to look that far ahead. Okay. This practice, the way that we've come in the last 4 or 5 years, I couldn't be happier because it's nice to be able to work in an environment. I'm like a diva at work. Like if my sectional matrix isn't there, if my nurse hasn't got an instrument that she's plucked from her brain that I need in my head, I'm like, what is going on here?
Hissy fit time.
Yeah, hissy fit time. So it's nice that I can work in an environment that I do love, you know. I do think that I will start another practice, and I'll probably start it in a way that I'll probably still work here a few days a week, but then maybe start maybe a squat or maybe even think about buying somewhere that isn't that's small at the moment that I think has the potential to expand. Start there a couple of days, and then try to do the same thing to that like I have done with this place. I've started upping the teaching a little bit more, you know.
I enjoy that.
Yeah, I enjoy that, you know. It's a nice to try to pass on some enthusiasm. You meet people that you probably wouldn't meet otherwise. Yeah. Some of these bigger corporate companies that you start to do a little bit of work for, it's nice to have that side of things. Like they'll entertain you, they'll take you out to spend a couple of nights at a hotel because you're teaching whatever. Yeah, exactly. So any corporates, here I am. And yeah, we'll see. Something like that.
Personal life? You left that one out.
Personal life, I keep that a little bit close to my chest.
You do?
But then you don't know what's going to happen in the future though. So you can't, I would hate to kind of want something and then that not happen, or because I want that thing so much to let it kind of force me into a pathway, you know? So I don't really tend to look that forward. Look, I would like to think of myself settling down, you know, maybe having a little George the Dentist one day, but we'll see. I don't know.
Nice. So at the moment you're not with anyone?
I've got a girlfriend. Yeah, I've got a girlfriend. Beautiful young lady.
Beautiful young lady?
She knows who she is. Yeah.
She knows who she is?
Yeah.
She's gonna...
Yeah. Well, maybe.
Imagine
wait, no, cut that. Cut.
So we're going to do rapid fire round now. It might not be so rapid, but...
Yeah. I'm not... this is pressure.
This is a lot of pressure. Make it intense. Increase the lighting, please, guys. On George, yeah, thank you. Okay, so first word that comes to your mind when I say now.
Ebacs.
He's so sad. He thinks of teeth.
It's because today I've been like, upstairs prepping away. I'm like, I need to speak to my lab.
Alternative career option.
Astronaut.
Really?
Yeah, I'll stick with that.
Okay. You really think you could be an astronaut?
Yeah.
Yeah, I can see you floating around in space. Okay.
Thank you.
Best teeth you've seen on a celeb?
I saw this question out there earlier, actually. An easy one to say is like Julia Roberts, right? Like big, wide smile, happy days.
Worst teeth?
Worst teeth. Who's that guy who did The Office? His aunt, Ricky Gervais. I mean, he could do a little bit of work. So if he's watching, he knows where we are. Yeah. But no offence, though, personality.
That's what matters.
Yeah, exactly.
Yeah, we're not We're not judging any teeth. Okay, if you had a chance to change your name, what would you change it to?
Quite that name, Harry. I'll
George,
take Harry.
Harry, you're going quite royal, aren't we, Harry?
Well, you know.
Okay, Harry. So, Harry, what's the most embarrassing incident with the patient?
So I had one, right? I was at a checkup or something, and I meant, basically at the end, she was like, that you can stick your fingers in my mouth at any time. And I was like, well, I don't think she means a checkup there.
That's like the comment he made about the wall when I asked to interview in front of this wall. You can insert the screenshot of our conversation here. Okay. Okay, what is your worst quality?
I can be a little bit impatient, right? But I think that if something doesn't go kind of perfectly, it can stress me out, you know, and I can get in a little bit of a bad mood. And like there are multiple times where at the end of the day to my nurse, I'm like, look, I'm sorry, Angelica. I was like, you know, say if like, you know, you're trying your matrix band in, it doesn't go in, you try another one, then it's like, that's going on the floor now. And I'm like, sorry guys.
Yeah, I think we've all done that.
Yeah.
Internal meltdown.
Yeah.
Got it. Okay. A dental colleague that you admire?
Okay, that's a good question, right? I think Monic Vassant.
Yeah, one of his course.
I think he's done incredibly well. His dentistry is just exceptional.
I know.
It is next level. I think he really keeps his qualities there. Yeah.
Always.
On a personal side as well, like his practices are going really well.
Yeah.
He does his courses are going really well. Thomas Taha. Right? Dr. TRH's Instagram thing. Yeah. His work is just next level. And I think that his dentistry is just absolutely insane. I look at that and really admire that.
Yeah. What's the most unprofessional thing you've ever done?
I got, you know, after your VT day? Yeah? You know, did you do that weekend where you go to like Centre Parks or whatever?
No, my VT scheme was boring.
Basically, you do this like weekend away in like Centre Parks, basically.
Yeah.
Basically got so drunk there, got thrown out of Centre Parks, basically. Kind of escorted out maybe by police. But that's the past now. And I learnt my lessons from it and became more of a professional. Yes. I won't go into details.
I want details now.
Yeah.
And keep that one close to yourself. Okay. What makes you angry?
People walking slowly in front of me.
Yeah, that's annoying.
Yeah.
I think, are you tall?
Not particularly.
I think it's because I'm tall. So like when I walk, I've got big steps, and my one step is equal to
the
short person's
Get out of the way, that
like
kind of thing.
Yeah, do you get road rage as well?
I'm not too bad on the roads.
So just angry pedestrian?
I'm not too bad on the roads. Actually, I live on like quite a tight road. I've come out a few times since I've lived there, and my car's been scratched. That's made me angry.
Yeah. Did you zoom into his face there? I got the foul.
Yeah.
Okay, most daring thing you've ever done?
I've done like a bungee jump, skydive. They were like bungee jump was pretty scary actually. Yeah. Because it's like all relative to the floors there. Where skydive, you're like, that's a bit further away. It doesn't seem.
So skydive's cool because you'll dive and you get to the floor, but with bungee jumping you like dive and you go back up for more. I couldn't handle that.
That's the point of the bungee cord.
Yeah, I don't like the idea of that.
Okay.
Yeah. It's like done once, that's it. Don't want to do that again.
Yeah.
What is one of your most memorable or amazing cases with a patient?
I think that these cases are coming more and more now, to be honest, because I think that, again, as the career progresses, you get a lot more confidence about treating this type of thing. Yeah. Like at first, when you start dentistry, you know, you're treating a single tooth. That's caused pain, you want to treat that. Then it turns into you're treating like a quadrant. Then it turns into like the mouth as a whole, and then it turns into like the person as a whole, right? Yeah. It gets to a point where you're a bit fearful of these bigger cases, and you're almost like referring them off. Mm-hmm. You know, like, oh, I don't really know how to handle that. Yeah. But what's nice is that when you kind of have your specialists around you, if they need a bit of ortho or whatever, you can do it. And I've done, in the last kind of few months actually, there's been a few I would like to think life-changing cases that have made a big difference. And at the end, although throughout that time it's terrifically stressful because everything you want is perfect, it's at the end when it all works out, you've got a few nice photos and you look back at it, it's it's worked nicely. I've just finished one actually, which is a full mouth, every mouth. I'm not a heavy dentist. I always try to avoid cutting if possible.
Yeah.
But sometimes when you're looking at nice ceramic works, you have to do a little bit, right?
Yeah.
In a minimal way, and it should all be planned well. I've just finished a case where it is full mouth rehab, and that's worked out really nicely, actually.
Yeah. That's good.
Yeah. We can put some photos up.
Yeah, let's insert some photos here.
Yeah.
So who do you nominate next for me to?
All right, this would be a fun one for you. Have you got Dr. Afan?
Actually, I do have him.
Yeah?
He's waiting for a time when he comes down into London.
Okay.
But we'll tell him that he wants him.
Yeah.
Dr. Afan, he wants you.
All right, have you got Simon Chard?
No, I don't.
Yeah. Him or Slane. Slane Smiles.
Okay.
Yeah.
I do follow them both. I will attack them.
Yeah.
Good stuff. You've been nominated, guys. I like that. Thank you so much, George.
My pleasure. My pleasure, guys. Thank you.
Something like this where it's like